Good morning, everyone. This is Colonel Mark Larson, the commander of the 914th Air Refueling Wing, coming to you from my office. I'm here with Lieutenant Moreau, my public affairs officer, who's going to be helping me facilitate, along with Kevin Nichols, another member of my public affairs office. Hopefully we'll be able to answer a few of your questions, and I would encourage you to start typing them in now, and so when we get done here with a brief intro, we can start answering some of those. This Facebook Live, we decided to do this because there's such a host of information out there, and I want you to know what's going on in the base. I want to be connected. It's the first of probably several that we'll do through the course of this virus that we're dealing with. It's important to me to make sure that you know that we are concerned about all of our airmen. And that's kind of the theme I get from my leadership, from General Scobie. General Goldfein is we take care of airmen. That's the top priority. But we do have to keep missions going, so I wanted to kind of outline what we're doing here specifically, answer the questions where you have concerns. As you can imagine, it's constantly changing environment. I get inundated daily with multiple areas of change and concern and policy, and we try to weed through that and feed out what we think is pertinent to our individuals. But we are concerned, and we want to make sure that we address your concerns. So, again, I think that, I chose to do this in my office. If you look behind me, one of my favorite pictures is on the wall, and I look at that almost daily when I come into my office, and it reminds me of what we do as Americans. I think about George Washington and Valley Forge, and marching into Valley Forge in the winter of 1777 with 11,000 men, having been defeated twice in battle and lost the Continental Congress's capital of Philadelphia and Brandywine, and 11,000 tired, hungry, ill men marching into a place under the shadow of Mount Misery and setting up what would be probably the fourth largest city in the colonies at the time. And what did he do, and how could he deal with that, and how could he overcome what seemed to be such great obstacles and still go forward and come out of that situation better? He marched in there with 11,000 men in December, and in June, when he marched out, he had 18,000 trained and hardened soldiers. So sometimes things that happen to us demonstrate our capabilities. It opens up opportunities to improve things. We're seeing some things happening that I just sit back and wonder, why didn't we think about this before? And it's unfortunate it took a pandemic like this to actually get us to think about some things. But there's some good things happening. So I wanted to let you know what we're doing here at Niagara Falls Air Reserve Station. I will tell you that we have never been more connected with our senior leadership. Every day, myself and my senior leaders on the base are involved in a secure video teleconference with the AFRIC senior leadership. We then take that information and we have a base-wide with all of our tenants and all of our commanders and leaders, and we have a daily meeting that we outline what's going on and update policies and procedures and get their input and find out what's going on in our local area here as well. So we are extremely connected, and we've never had a better arrangement with our tenant units, and we are aware of what their needs are, and we coordinate very closely with them. So again, like I say, our main concern is taking care of our airmen and their families. I know that we have a number of people who are downrange and deployed, and that causes concerns in a good environment, let alone in this environment. So I want to answer those questions that you may have as we go forward. So let's talk about the base proper here. What is the base doing to deal with coronavirus, and what is the status of the base? It's interesting, the other day we had one of our airplanes flying. We actually got a question from the community as to whether we were flying in response to something that was happening with border closures. But we've identified what our mission critical priorities here are, and we're daily working to continue those operations, not only for the people here, but we service a population of the Air Force that has mission needs. We have to make sure that we continue to be a capable military force that's in the fight every day. We're not pulling our forces home from the AOR, or we're not curtailing our operations overseas, so we have to make sure that we keep those missions going. So that's our priorities here, is to keep that going locally and for the people who depend on us for training and support. Okay, so as far as what's going on, we have implemented maximum telework based on the guidelines, not only from the CDC, but from our headquarters and from the local state officials. We've been doing that starting this week. A lot of our people are telecommuting, teleworking where they can. We have allowed people to take care of things with child care needs where we can, and we're trying to individually adjust to people's situations out there. We have done some restrictions to the base. You'll see if you've been on base, particularly those that come on and off daily. We've identified who our mission essential personnel are, and we're not allowing people to come on base unless they have a bona fide need to be here for mission essential activities, be it civilians, contractors, or DoD, Air Force military personnel. Same thing, we're in lockstep with our tenant units out there as far as who's coming on base. So we've identified those mission critical activities. Obviously our first responders, firefighters, etc. We're continuing those operations as we always have. But you'll see when you come on base, we've curtailed admittance to the base, and we're screening people coming on the base. We're asking them some screening questions as far as, have you been exposed? Are you feeling symptoms? Have you been to level 3 countries, or travel level 3 has been outlined, and then we're turning them around if we feel like there's not a need for them to be on base. And that can be an upsetting thing to people in the community, but we've taken that action just to make sure that we don't have an overabundance of people on the base who don't need to be here for mission essential activities. The other things that we are doing is we're kind of limiting and social distancing here on base. We're trying to adjust shifts and workspaces so that we are not meeting in close proximity to one another. We're doing a lot of telecons, meeting sites where we can do that remotely. That enables us to reach out to the people that are also working from home as well. We've curtailed admittance to certain areas. Our lodging facilities, we're using only military essential people there. The gym, some of the things that maybe you're used to being open, we're making sure that we are sanitizing those regularly, and we're limiting the people who have access to those. Other things that you'll see that we're doing is we are also looking at what missions we fly, what missions we support out in the community, and then we'll post as we see the need to change different health protection conditions. So we're monitoring those every day. We've increased our health protection conditions a little bit, which is why we're doing some of the things you see at base to limit people who are coming on here. Big question about training and UTA status. I will tell you that we have determined to reschedule our April UTA. I held off until I got a good feeling as to whether or not we could have people come in. I am conscious about the fact that a lot of people have notified their employers. They depend on that for training and for income. So we determined just yesterday to move our April UTA to July primarily, with the option for commanders to reschedule that liberally as we need to accommodate people who may have already had vacation plans or family plans as a result of us previously canceling the July UTA. There's also a need to allow people to schedule some of their UTAs in August to correspond with an exercise that we'll be planning here, and then there's obviously a need to look at people who may need to get a good year in points and things like that. We're looking at those individuals specifically so that we make sure we don't adversely affect anybody by doing that. The May UTA is still on the schedule. We'll make a determination of that later. There will not be a change of command ceremony here at this base just because of those kinds of things, and we're limiting some of those big meetings and social events. We've also canceled any kind of a social event that we were having here, the Easter event that we normally have, which is something we like to do. We're not going to have that this year. We had a theater night over at the club. We're not going to do that either. It's strictly military essential activities that we're doing on the base. PT is another question I get occasionally. What are we doing with PT requirements to test? Those have been postponed to June for those in this quarter, and I anticipate that there will probably be more postponements as we go forward throughout the year. So we're still flying. Our tenant units are still open. Sometimes I get questions about recruiting. Are we still recruiting people? Yes, we're sending people to basic military training. Our recruiters are still out there recruiting people. We are screening those people who go to those courses per direction so that we make sure that we send healthy individuals down there. The MEPS is still open. They're still bringing people in and processing them into the military. We have kind of tried to limit the family exposure, so we're trying to come up with ways that families can see their people sworn in remotely so that they don't have to come on base as well. Okay, so again, we're still maintaining our mission. In fact, there goes an airplane right there. I see one taking off and flying as we speak, and that's a good sign. I think it's a good sign to the community that with all the chaos and what seems to be a world in free fall, that there's some things that are still steady going on, and we as a military are here to take care of our airmen, their families, but we also take care of Americans, and we'll do whatever we need to step up those efforts. I know there's some concern. There's other bases that you may be aware of that have been housing people who are in quarantine status. We have not done that yet. There's not a request for us to do that yet. But of course, if that comes, we will respond as we need to take care of Americans. I know that some of our tenant units are actively involved in doing that. I can't really speak to what they're doing because that's their mission-specific sets, but I would encourage you to monitor our Facebook page, our website where we post current information. We also have links to the AFRIC website where you can get up-to-date information on travel restrictions, coronavirus restrictions. You can monitor the 107th page for their things, and as well as the Army National Guard that's out here as well. So I'm concerned that I want to make sure that everybody gets the message. We were trying to figure out how to best do that. I can tell you that tomorrow at 2 o'clock, General Scobie and Chief White, the AFRIC commander and command chief, are also having a Facebook live session. And it would be good for you if you have questions to hear directly from your command leadership that way. We've also been in direct communication regularly with the 4th Air Force Commander, General Ogden, regarding what he would like to see in the NAF. So we are extremely connected with our leadership, more so than I've seen in a long time. Almost daily we have meetings with them via some telecom or VTC method. So having said that, I know there's some questions, Monroe, there's things coming in that we need to, people are concerned about. I want to answer those questions and then kind of wrap up at the end.
Yes, sir. So the biggest question on everyone's mind is, I would like to know if deployers will be still coming home as planned.
Okay. So right now the stop loss does not involve those people who are deployed. They are still planned to go out as planned and come home as planned. I know there's been some questions as far as what do we do with people who are out in the system in military status, who may be in those areas that I'm sorry, I shouldn't itch my nose, but I did. But those areas where people are deployed TDY or they're in military status, how do we handle those? And the military is looking at the options of if those people are coming back in a particular status, then we have to continue. If we have to isolate them or restrict their movement, we'll keep them in that status and pay them to do that. But right now there is no plan to delay people coming home. We have a few that we're expecting back in the next several weeks, and we're constantly monitoring the combatant commanders' restrictions and how they're going to be here, and working on courses of action on what we do when they land here. But right now there is no plan to delay them.
So next question, is there a plan in place for offering administrative leave for personnel currently using annual leave for child care purposes?
Yes, so if you're in a situation where you are a single-member family or a two-member family and spouses are having work situations and there's child care issues, I need you to contact your supervisors directly. There are some things that we can do to offset those requirements, so you have to use all your annual leave. We're trying where we can to maximize telework and telecommute in those instances. The Air Force did relax, or the DOD did relax. It used to be with telework that if you were caring for someone in your home, you were not authorized to telework. They've relaxed that policy from March 1st until the end of this year to allow people who are home with dependents, either children or elder dependents, to telecommute in those situations while you're caring for your family. So we need to address those on a case-by-case basis. But again, the guidance from me and General Scobie has given us is that commanders need to lead at their local level. They've given us a lot of autonomy to work some of those issues, and we will do that on a case-by-case basis. Let's see what we can do to help.
Sir, next question. Will screening be available for members who are located on base that are currently on long-term orders on the installation?
So our personnel are not able to screen. Talking about the COVID-19 screen, we're not able to do that. What we do is for our people who are planning to come in on orders is we have some pre-screening questions that we'll ask them to determine the level of risk of bringing someone in. So there's kind of the same screening questions that we do for people who are leaving from here to go to BMT. Those people who are going off station to training schools, technical schools are being screened by our medical personnel, either here locally, asking them some questions, just taking a general notice of their general health, and then we allow them to transfer to those locations. As far as doing COVID-19 screenings, we don't have any plan to do that, nor do we have the kits and the capability to do that.
Sir, next question. Will outside contractors be allowed on base? They could be carriers, because we don't know what or where they go after hours.
Right. The same thing's true with our civilian population. I have no idea. I put out guidance to restrict movement as much as you can, to avoid places where there's a high risk of contracting the virus. The same thing's true with our civilian contractors. But to be honest with you, some of them are mission critical for us to operate. So what we did just recently, as I said, we're screening as they come into the gate. You'll notice if you come into the gate now, our signage is a little bit different. It will notify you that we're looking for certain things, and when you come to the gate, we ask people questions as to where they've been in the last several days. Are they feeling symptomatic? Have they associated with anybody who may be symptoms? And so we're trying to screen that way, but we're allowing our civilian contractor, who's under the same mandate as anybody in the state as far as reducing numbers of people at work, to only bring in those people that are mission essential, and we're curtailing those activities where we don't need. For example, we have 2 billeting facilities here on base. What we've done is consolidate all of our military personnel into one building, and that allows us to shut down the other building, turn down the electricity, not have to clean, reduce the number of people we have in lodging. Same thing with CAC. We've gone to takeout only over in our clubs, so that we don't have to have the same number of contractors over there doing or civilians over there doing food service. So we're looking at all the functions on the base and reducing to only those things that we need for mission critical activities, and then we're allowing the contractor to downsize where they can as well. So we're under the same, they're apprised of this screening. We're encouraging them to follow CDC guidance and to screen their people coming in as well.
Sir, next question. Is there any further guidance or updates on the DoD personnel movement ban?
Okay, so we get a lot of questions about that, and there's a lot of confusion about stop travel, DoD bans, PCSs, all those kinds of things. This is probably the one area where it's the most moving target. So the way you can think about this is, if you are somebody whose movement is involved with the government is paying you to either travel or to go to a place, those area restrictions are pretty set. You cannot travel outside of your local area based on where you live to places that are travel country 3s. We screen you before you go to travel country 2 areas, which is basically all the United States. But I can't restrict people who are straight civilians, i.e. I have a lot of airline pilots. Their job takes them, and professionals that travel all over. I cannot restrict where they go. I can only provide the guidance to be understand where you're going and the risks involved, and then screen when I bring you back on. But if you're a civilian off duty and you determine you want to go somewhere, we will screen before we bring military personnel in, and we're encouraging our civilians to follow the CDC travel guidance and to self-police on that area and not travel outside. But I have no control over somebody who's a civilian and they're off duty where they go, other than to encourage responsible behavior.
So we had another question here. What happens if a reservist is in danger of having a bad year due to COVID-19 travel restrictions?
So I hit on that just a minute ago. There's not only that, but it also affects people in our wing who are in a program that offers pay bonuses based on their AFSC. Some of those are required to get points in a certain number of points. So if you're somebody who has a risk of getting not getting a good year based on your points, we're asking you to contact your supervisor, and we're looking specifically at people who are tied to bonuses, and some of those we've identified people that need to be we need to look at specifically. But if that's the case, there are ways to telecommute in military status. There are things that you can do in military status. We can schedule UTAs with you not being here. There is training that can be done remotely. So I need people to self-police that and tell your supervisor if you're at risk for not having a good year because of me moving UTAs or not allowing people to come in because they're not involved in a mission critical activity at that time. That's where the communication needs to go. talk to your supervisor, and we will work those cases. Because again, taking care of airmen means we don't want you to go and not have a good year because of something that we're imposing because of this virus.
All right, we have time for 2 more questions. Just really quickly, if we don't answer your question here, still feel free to comment, and we will be sure to answer that at a later time for you, because I know there's a lot of questions coming in.
Okay.
This question, sir, is a follow-up about the DoD travel ban for reservists. He asks, so more particular, as a reservist, can I go on a vacation, for example?
As a reservist?
Yes,
straight
sir.
TR, civilian, go in your civilian capacity? I can't tell you not to go on vacation. I will tell you that I've had some people who have been on vacation and who are traveling back, and depending on where they went and what they were exposed to and how they traveled, there may be some restrictions on coming in as a TR. So when you go as a TR, you go out as a civilian on vacation, and now you come back into the local area and you want to come in and do duty. These questions that we're going to be asking to screen our military members will probably restrict some of that depending on where you've gone and what you've done. So just be advised, if you determine to go on a civilian vacation and you come back and think you're going to come to the base and do duty, before we bring people outside the local area in to do duty, we're going to ask some screening questions to make sure we don't bring something onto the base. Now, presently we have not had any cases associated with personnel on the base.
And sir, final question. What is the recommendation for members that serve as healthcare personnel or first responders as their civilian job?
So we have a lot of those, particularly in our ASTS and AES, our first responders, those folks who are out there doing their job every day and may or may not be exposed to this. So our guidance is follow the CDC guidelines for your profession and what you're doing. Follow their counsel. We're going to continue it, like I said, before we bring people in, screen. But my advice would be, follow the guidance in the CDC. They're pretty specific on what they do with those individuals.
So, sir, that's all the time we have for questions.
Okay, so like I said, we'll try and do this regularly. Again, look at our website. We'll try and answer the questions that we're getting that I don't have time. And if you can, dial in tomorrow to the AFRIC leadership. I would just say this, as we go through this, there's a lot of things going on out there and a lot of information. Be careful of some of those sites that may be putting up things that are inflammatory. There is some scams out there, phishing scams, to try and get people to click on things, particularly if you're looking at the locations where this the COVID-19 virus is. You may click on a site thinking you're going to look at a map, and there's some phishing scams out there you need to be careful of. So be careful about opening up things that may infect your computers. The other thing is, I would just say this. In all of these times when we go through these crises, we need to band together. That's what we're good at. I was really interested to see last night that even some of the political fervor that's been out there and the animosity seems to be dying down. We work together as Americans, and we get through these things, and we learn things, and we come out stronger as a result of it. Like I said, with regard to General Washington, when he walked out of there in June with 18,000 men, they had been through a winter. They were battle-hardened soldiers who probably could understand and deal with living in circumstances that maybe their counterparts weren't used to because they didn't endure those things. We are learning a lot of things, and we're seeing people step up. I'm grateful for our key spouses and all those who work. Our Family Readiness Center, our folks are here if you need help. I know it's a turbulent time with regard to finance. We have Mr. Givens who's here who can help apprise you of that. And Dan Norton's here. Your supervisors, we need you to communicate with us if you have concerns. And we're here to do what we can to help you. Again, it's my position that we're here to take care of our airmen and their families. That's what I want to do. So let us know how it's going in your lives and keep us abreast of what's going on in your situation. Thank you.